requests, numerous requests to talk about thoracic pain, thoracic nerve and disc issues. So I'm starting with this first image, and now these images are not mine. You can find the address up here and go check them out. I have not vetted these as resources. I'm only using these images for descriptions by all means. So if you want to check them out, go ahead. So when we talk about the spine, we have the cervical spine, basically the neck. Thoracic spine is like upper and mid back. Lumbar spine or low back. The sacrum, which are fused bones down below the lumbar spine, and the coccyx, which is another set of fused bones. Now, if you've ever suffered thoracic pain, most typically it'll show up. I definitely have. Most typically it'll show up pretty localized at first. It tends to feel like pressure or deep ache, but that tension can kind of spread out. You can feel like it wraps around your ribs, or even you may feel pain in your chest. There are people who um, wonder if they're having a heart attack because this pain in the chest can get so intense. But most people who've really suffered this and dealt with some of the consequences will remark how it's hard to take a deep breath in. Rotating, turning, bending can all get affected. Reaching gets affected because these bones need to move in order to reach. So if that's you, you can comment, share. Now I'm going to go ahead and show this image again because we have the thoracic spine here, but you can see there's something interesting about the thoracic spine that the other parts of the spine don't experience. We have these ribs, and they're actually attached to the bones of the thoracic spine. And that's very important because when we have issues or limitations in the thoracic spine, it affects the mobility or lack of mobility in the rib cage. Mobility in the rib cage is very important for breathing. And so people who have stiff thoracic spines and stiff ribs tend to not be able to fully inhale and fully exhale. And there has been research that's shown that these people will have a higher level of cortisol or systemic inflammation due to this restriction. This restriction is something the brain reads as a threat. And so it can also trigger extra or inessential activation of the sympathetic system of the body. You can also see that the shoulder blades are connected to this whole setup, right? We have the collarbone, shoulder blades, and then the shoulders are over here. So if we have dysfunction in the thoracic spine, it can actually cause you to have shoulder issues, neck issues, low back issues, and I already mentioned breathing issues. So this problem can be quite pervasive and traumatic to a person when we have an issue in this thoracic spine. And so what are the issues, right? Well, another element of the whole spine is that we have these nerves that exit at different levels, and the thoracic spine is no different. At different levels, these peripheral nerves exit, and then they innervate tissues of the body. And so if we have a thoracic issue, it can lead to inflammation, irritation, and swelling and dysfunction of these nerves. So this is another view just including the cord, right? So we've stripped away the spine now, and you can see how the cord descends, and then nerve roots branch off from the cord, and this all happens within the spinal column, and then these nerve roots exit. Now, where these nerves exit is a very precarious location. There is a space between these bones that's called the foramen. Now, if you talk to most medical professionals, they're going to have you thinking that this space is like a hole. And a hole in most people's minds is one size. And so if it's one size, but then that's restricted through some form of stenosis, now you start thinking, oh my gosh, my nerve, there's nothing I can do for it except, drill out that hole or put a new disc in or something like that. But the reality of that space that's around the nerve root, the foramen, is that it changes based on your position. So you can position your body to create more space, thereby relieving irritation on the nerve root and helping to steer towards health. Or you can position a different way and it would irritate the nerve root. And so real quick, back to the nerve root. So these nerves, as they extend into the body, are called peripheral nerves. And the difference is the peripheral nerve has a much better protective mechanism. The nerve root is more vulnerable. It does not have as much structural protection, and so it tends to get irritated more easily. Now, then dealing with that and the fact that it has this space that can change size, and the tissues that make up this space, they can get irritated or inflamed, and they can cause the nerve to become irritated or inflamed. So there's all these layers that can lead to a problem at one of these thoracic nerve roots. So let's take a peek at that. So we have this top-down view, and essentially the grayish-brown stuff is bone. Now, underneath to this bluish thing here is the disc, the spinal disc. Underneath it is more bone. And you can see how the bone kind of extends out. And we see there, so in this image, they're making this look like this is a hole. But above this is another bone, another bony structure. And so the position of your body can reduce this space this is the nerve root. And as it exits, we can position to create more space or less here. But you can see these tissues. If there's bony spurring, if there's disc bulging, this joint here, this facet joint, if this joint gets irritated, it can start to irritate the nerve tissue. So we can see how there's layers of things that might have to be dealt with. And actually down here at the bottom, they show a herniated disc pushing on the nerve. And that just looks hopeless. But again, through repositioning the body, you can actually reduce that compression. And I argue that, most people want to go after this structure. They want to deal with the disc because they look at it and they say, oh, that's the problem. The disc isn't the problem. The problem is that the nerve is irritated. Disc pain doesn't tend to be severe. They're not highly innervated. Okay, again, we heard the word nerve in there, right? So it's the nerves of the disc that tell you if the disc is hurting, but they tend to not be so high threshold pain. But these nerve roots will scream out very loudly. And so even minor irritation of a nerve root is going to create muscular tension. Okay, so over here on the right, we see this good image of the spinal column. And we have, now this is, I don't know, we talk about thoracic radiculopathy here, but this is the cervical spine. So it's kind of a misnomer, but we'll deal with it, right? So as these bony structures are stacked upon each other and these discs are stacked between the bodies of these bony structures, again, between this bone and this bone, there's a space for this nerve root to exit. Now that space can get compressed, but it doesn't have to be. The nerve can get irritated, and this is a very likely spot for the nerve to get irritated. When that does happen, you can count on two things, even low-level irritation. Well, I should say three things. There's going to be protective muscle tension because your brain will read this threat. It happens subconsciously. And your brain is then going to react by trying to protect the area. Well, that also creates protective weakness. Excuse me, meaning that your brain will make you weaker head to toe when it senses a threat. But definitely locally, the strength and stability provided by the neuromuscular system, there's that neuro part again, will be limited and it will be dysfunctional. It will be a pain-based pattern of support, which changes how everything in here moves and then changes how everything else in your body moves. So we have this protective tension, this protective weakness, and we're going to get at least low-grade inflammation. Now, the consequence you may not even understand or experience as a problem. But as that irritation increases, then you're going to start to notice little differences in how you move. You may feel more tight. You may feel stiff. You might have an achy shoulder or an achy knee or something that seems completely unrelated start to come and go. If this irritation gets bad enough, obviously they've used the color red to say the alarm bells are on. And so that's when we really will feel it. We'll feel that pressure, that pain, that wrap around the ribs, squeeze. And so I put all this out here to show you that there are very practical and simple ways that you can begin to recover this. Now, I want to back up the bus just a bit because the things we're talking about are less structural and more functional. So it's less about what it looks like. It's more about how things are working. And so, for folks who have cervical issues, it can be common, you guys notice that you also end up having this pinch in your back, or these mid back issues or scapular issues as well. And that's because functionally, when the neck is not working well, it can change how the thoracic spine works. And so again, there's these layers that can be addressed. And if I could give you a cookie cutter approach, I'd give it to you, but there isn't one, because how each of these things affects each person is a little bit different. I typically start with the nerve and support the nerve, because if we're not supporting the nerve, healing is going to be slower, movement is going to be restricted. The alarm bell to your brain, that protective tension and that protective weakness, those aren't going to go away. And so if we try and start with the muscles, we're kind of putting the cart in front of the horse. And I don't know if you've ever seen a horse try and push a cart. It doesn't work very good. So there is a logical way to approach this, but some people, things are so tender here, we can't go here first. We have to start at the neck or even low back. Some people, we can get started right away on the thoracic spine and start alleviating. Many people have, some people have pain that's more centered. Some will be off to one side, and some will be both sides equally. And those all have a different approach. So if you're curious about approaches, this is something that you deal with and you want to talk about it, I'm happy to talk through your particular circumstance. Just comment support and I'll reach out and connect with you. If you have other questions, feel free to drop those. If this felt helpful, let me know. Tell me helpful. I appreciate it, and hopefully you gained something really helpful from this.